Month to month, box to box. This is how we live in the GLP-1 community. We never know when our coverage is going to get yanked from underneath us. Last year, it got yanked out from underneath me, and I had to go the compound route. I had to go to a telehealth. And what alleviated that financial burden a little bit for me was using my HSA card. I went to the hsastore.com to look for some electrolytes. ShedRx is there. ShedRx, the telehealth, is HSA approved and FSA approved. Ah! So I'm going to ShedRx, right? And I'm going to use my HSA, which alleviates a huge financial burden for me. And if you're interested as well, go to shedrx.com. They'll take great care of you. They've got fantastic doctors. And you can use the link down below in our link tree, or just go to shedrx.com and use my code, CAT50. Get your $50 off your first month.
So for people that don't know you and watch your TikToks like I do, can you tell us a little about who you are and how you help people?
So my name is Kayce Sirona. I'm a bariatric surgeon, so I specialize in weight loss surgery. I grew up here in Southern California. My practice is in Orange County, and essentially I help patients who struggled like you guys did with obesity all their lives, and I was told by doctors to diet and exercise, and that it's under their control and they can fix this problem. And I help them, with managing their chronic disease. It's exactly what you described. It's a chronic relapsing disease, and now it's amazing that we're finally able to accept that. And I think as we're able to accept it, we're able to provide better treatment for patients to address this. And it's a complex condition, and it's very, very difficult to treat. Being a practitioner who manages obesity is definitely not easy, and it's much harder on my patients than it is on me. But I see and I struggle with them through the process. So it's a very gratifying position for me. I love my job. I love to be in the operating room and do surgery, but I also love to develop relationships with my patients. And with weight loss surgery, the nice part is that you really become like family. So I see my patients, as you guys know, on a yearly basis, because, with weight loss surgery, you do have to monitor things like vitamin levels. So, my patients, like you mentioned with your doc in Mexico, my patients text me, they'll send me pictures of their updates years later.
Uh-huh.
And it's great. So I'm very happy to be doing what I'm doing, and I'm honored to be able to help patients who have been struggling with obesity.
That's awesome. I'm curious, like when you were in school and you were like, I think I'll be a doctor. And then you decided to choose a specialty. Like, why did you choose obesity? Why did you choose, like, in terms of being a surgeon? Why were you like, this is the kind that I want to do? What was that driving force?
Yeah, that's an interesting question. And honestly, it never even crossed my mind. When you're in residency, you get exposed to all kinds of different operations. So you do pediatric surgery, trauma surgery, oncologic surgery, which is cancer surgery. And so one of those rotations is bariatric surgery. And I was always kind of I gravitated towards laparoscopic and robotic surgery, which is minimally invasive surgery. I'm really good at it. And one of the most complex operations that's done laparoscopically is the gastric bypass. So it's a very challenging operation, but also a very gratifying operation. So naturally, I chose bariatric surgery as my route. And as I did more bariatric surgery and got to learn a little bit more about it, I understood, the importance of the education and the counseling and building relationships with your patients. That's what really kind of drew me in what was really great for me. So that's how I ended up in the field. And I'm really glad I chose that field, just because, like I said, you develop these invaluable relationships.
Yeah, that's awesome.
That's very awesome. Okay. I'm going to build on, well, I'm going to ask the question now. Could you describe for us some of the varied types of bariatric surgeries there are, and what the procedures entail? And also if there are any procedures that may or may not be covered by insurance, like if there's new ones coming out and things of that nature.
Sure. So when you think of bariatric surgery in general, I like to categorize it in terms of restrictive and malabsorptive operations. So restrictive operations are operations that decrease the size of your stomach. So the most common one is the sleeve gastrectomy. And the sleeve is the most common weight loss operation that's done in the US. Before, it used to be the lap band. Now the lap band has decreased in terms of volume. It's kind of gone out of favor, and the sleeve is the more more desired operation by patients, and patients tend to have better outcomes with it. So in the sleeve, essentially what we do is we decrease the size of the stomach by 80%. So typically, a normal stomach is about the size of a soccer ball, or a ball, and can fit 2 liters of food and fluid. We remove or excise 80% of the stomach, turning it into a banana. So a significant portion of the stomach gets removed, and that causes hormonal changes that help induce weight loss, but also causes what's called restriction. So you eat a small amount of food and you feel full. The other category is called malabsorptive procedures. These are a little more complex, and an example of a malabsorptive procedure is the gastric bypass. So the gastric bypass, essentially what we're doing is rerouting the intestines. And the reason we do that is to decrease absorption of food and nutrients. So with the gastric bypass, not only do you shrink the size of the stomach, you make it even smaller than it is in the sleeve. So you make it about the size of an egg, so about two ounces, but you also reroute the intestines. And by doing that, you decrease absorption of food and nutrients, and patients are able to lose weight through that route, as well as the hormonal changes and the restriction. And then so those are the 2 broad categories. There is a less common malabsorptive procedure that's called a duodenal switch, or sometimes called a SADI. This is the most effective weight loss option. It's not done as commonly as the bypass and the sleeve, and that, like the bypass, causes malabsorption. But because you connect the intestines in a more distal or a further part, you have more malabsorption, so hence more weight loss. In terms of new procedures, one of the newest procedures is an incisionless procedure called an ESG. It's called an endoscopic sleeve gastroplasty. So it's kind of marketed as an incisionless sleeve. So it's done endoscopically through the mouth. So a gastroscope, or a tube with a camera at the tip, is inserted into the stomach, and the stomach is created into a tubular shape. So just like a sleeve, but nothing is resected or removed. So essentially, you're just shrinking the size of the stomach from the inside. And that procedure has been done for many years now. In terms of long-term outcomes, because it's a newer procedure, we don't have good data on the long-term outcomes, but in general, it seems like it's about half as good as a sleeve. So in terms of weight loss, a sleeve usually leads to about 20 to 30% total body weight loss. So if a patient weighs, let's say, this is just to make it easier, 100 pounds, they should expect to lose 20 to 30 pounds. With the gastric bypass, because we're not only shrinking the size of the stomach, we're also rerouting the intestines, you get more weight loss. So typically with the bypass, patients can experience anywhere between 30 to 35% total body weight loss. And with an ESG, the newer studies are showing that it's about half as good as the sleeve. So you usually get around 15, 16% total body weight loss, sometimes can be up to 20%.
Wow.
And I think you also talked about insurance coverage.
Yeah.
So the ESG at this time is not covered by insurance, so most patients pay out of pocket. The sleeve and the gastric bypass are covered by insurance, but as Brandy alluded to, it's a pain in the covered sometimes, and it's such a struggle as a surgeon and physician to get these operations covered. And sometimes we have to do what's called a prior authorization. We get on the phone with the, we have to plead our case. Like this patient, has a BMI of 37. They have diabetes. They have high blood pressure. And so you have to kind of plead your case to get it approved a lot of times. And the interesting part, because I was listening to Brandy talking about how, it's so hard to be denied, by insurance companies when clearly that you would benefit from this. And the interesting part is that the insurance criteria that we have currently is from 1993. And so it's completely outdated. Patients with a much lower BMI, BMI of 30 and above, actually benefit significantly from weight loss surgery. But it take a lot of time and in conversations like this for them to catch up and really, be able to provide patients the care that they need.
Wow. I'm going to be a little speechless. Oh, 1993.
Wow.
Yeah, I mean, so outdated. They're just dinosaurs.
Wow.
Denied coverage of your GLP-1? Do not quit. That is exactly what insurance wants you to do. You have rights and you can appeal more than once. Claimable makes it simple with expert-backed appeals that actually have been proven to work. Check out the link getclaimable.com/plus sides and use code plus sides with a Z to save.